in this moment of the pandemic and everything, and you as someone who's worked with nurses unions and have worked with all these healthcare workers, and their labor is being, I think, underappreciated. The country has been letting them down by not actually keeping its people safe and throwing them onto the backs of these healthcare workers. But how do you feel about this moment? How do you think this moment would be different if we had Medicare for all? A lot of people have said it wouldn't be. Where are you at on that?
We would have saved hundreds of thousands of lives. There is literally no way you could design a healthcare system that would be worse to handle a pandemic than the for-profit industry that we have now. Because why don't healthcare workers have protective personal equipment? Because these corporations, these hospital corporations, don't have oodles of supplies on hand. They just in time their supply chains, so they have only as much as they think they're going to need. Well, guess what? They didn't know how much they were going to need, and they didn't have it. The public health spending has gone down nearly 50% over the last 10 years. A robust public health system is at the heart of Medicare for all. There would not be 7.5 million people who lost their health insurance. There would not be workers of color who have to go to essential jobs that would have huge health inequities for years because their chronic conditions were not adequately treated.
Yeah.
We would not have a system rooted in white supremacy and systemic racism that characterizes our healthcare system, because we would have taken the path that Medicare started when it desegregated Southern hospitals and continued to address those systemic issues that cause these health inequities. So it's just hard to imagine how it wouldn't be different. We wouldn't have a fraction, I don't think, of the kind of failures in testing, in quarantine, in contact tracing, in vaccinations, if we had a fully integrated, publicly financed system that didn't depend on the profits of the insurers. They made $15 billion in 2020 during the pandemic. And 400,000 Americans, not to mention hundreds of thousands of people around the world, have died.
Yeah.
So this is a movement to save lives, and we would have saved them had we had Medicare for all.
I mean, it makes sense why they're saving money, right? Because people are not actually going to the doctor that much. I just said I wasn't going to the doctor. They're saving even more money, so they're making hand over fist money. But it is a moment, and it's interesting because I feel like I think a lot of times when there's a crisis, you're told by the powers that be that basically you have to scale back any of your demands, and you have to ask for less. And this is not the time, and there is no money, and look at all the people struggling. And I think that this country is very ready for the opposite response, which is this crisis has exposed just how actually hung out to dry working people and all people have been by our government, and the lack of any kind of healthcare system and a plan. But also, look, they're going to keep making so much money as we go forward, because the conditions that are going to be coming out, the health conditions and lasting health conditions that come out of COVID, are only going to spell more profit for them. And so we know this is an issue. We know, like, I'm tired of making the moral argument. Like, I'm tired of making the financial argument. That's like done. I mean, at least in these spaces, right? When we're on the left, we're progressives, we know what we stand for. The question is, how do we get the political will? And I know you were part of a national conference, a strategic conference, a strategy conference to talk about Medicare for all and the future of it on a national level, and that you actually wrote a strategy paper around this. So this is big, but broad strokes on how do we get that political will moving forward?
Well, what we need to change the conversation from whether to do Medicare for all to how. Mm-hmm. And so one way to do that, obviously, is to show real support in Congress for the Medicare for all legislation. So one of the things coming out of the strategy conference was an effort to get as many co-sponsors or more on that bill that we had last session when it's introduced in the next few weeks. And that will probably happen after COVID. Secondly, there's a project called Profit Over Patients Over Profits, Patients Over Profits, that National Nurses United has done, that exposes the contributions that the healthcare industry has made to these politicos, all these elected officials who are whoring for the health insurance industry, are taking millions of dollars from the largest political contributor to Congress, which is the healthcare industry, including the pharmaceutical corporations and these for-profit hospital corporations, as well as the insurance companies, right?
Yeah.
So they're all feeding at the public trough. We expose that. Secondly, we can change from whether to how if we pursue single payer at the state level, like in New York, like you discussed, and like in California. So if the governor puts in a waiver request, you've got a pro single payer guy, pro Medicare for all guy running Health and Human Services, probably Javier Becerra.
Right.
You've got a CMS administrator who's sympathetic. You've got a governor who ran on the issue. So that sets it up. Once he asks the Biden administration, hey, let us do this, then you figure out how we're going to do it. And we engage the stakeholders. Well, if we're able to successfully establish a model here in California, that proves, given that its size particularly, that we can do it nationally. So there are different paths, but that's what I think. That's what I argue strategically is to develop the political will. We have to expose the healthcare industry like it was tobacco, make it as toxic as tobacco.
Right.
The same. And then we do have to be concrete about how workers are going to be better off, how we're all going to save money, how we're going to save lives. We need to talk about that, right? But ultimately, this is a problem among Democrats.
Hey, thanks so much for watching the Bitchuation Room podcast live stream. And while you're here, why don't you just subscribe to this channel? I promise it'll be good. Promise.